Hello, I'm Dan Hawkins, a Majority Leader of the House of Representatives, and today I'm joined again by Beverly Gossage. What a wonderful opportunity it is for you to be here with me and talk to our listeners, Beverly. Beverly is an expert. You've seen it on the last video. She's an expert in her field of healthcare, health insurance. But Beverly has been working on the federal level. You've been on a task force in D.C. working on new health policy.
Yes.
So I know I talked to you here a while back and you said, Dan, if people knew what we were doing up there and what's coming, they wouldn't be so enamored with Medicaid expansion.
Not
Can you share with us what's going on?
As we said, each state prior to the ACA regulated their private market. That's about 8% of the people bought a policy in the private market. And what we've discovered, we've done lots of polling, and we found that rather than single payer that we keep hearing about, call it Medicaid for all, call it whatever you want to call it, a rose by any other name is the same thing. Medicare for all sounds more palatable than saying single payer national plan. But in reality, if you read the bills, they are going to repeal Obamacare, they are going to destroy Medicaid and destroy Medicare. So those won't exist anymore. Everybody will be thrown into this national plan. When we did polling and we asked, would you rather have a national plan or a personalized, customizable plan? Only pay for what you need, as the Liberty commercial says. Of course, the vast majority of Americans said they want personalized care. So in the state of Kansas, before the ACA, we had, if not the lowest rates in the country, we were definitely in the bottom 5 as far as states go. Individual policies for children were $25 to $30, young people $48 to $52. I've written policies for women 63, 64 years old, $165, $180. Now those are well into $900. So what can we do about that? If we say, you want customizable, portable health insurance, it starts with HSA reform. Ted Cruz in the Senate, and he's getting other sponsors. He already has Braun, who's a sponsor, and then we have Chip Roy in the House with a companion bill, is HSA reform. As you know, I help pioneer HSAs. My company's called HSA Benefits Consulting. That's because I want people to give less money to the insurance company and pocket more of your own money, use that to pay for things. The DPC relationship is becoming very popular. Direct primary care physicians, people pay $50 a month, whatever it may be, and then they can go see their physician more often.
It's like membership medicine.
Exactly.
Yeah.
And so that's becoming popular. However, under current law, just by setting up a DPC relationship, you are no longer eligible to have an HSA, or you can continue to use the funds till they're gone, but you can't contribute. So here's what we did with that HSA bill. We said, people want personalized care. There's nothing more personalized than buying your own policy. Employer-sponsored health insurance, it started back in 1943 as a dinosaur. People now change jobs on average every 4 years. So people would rather the employer give them money and they could buy their own individual plan. We will allow, through this bill, HSAs to pay for premiums. If you don't have a plan through your employer, you can pay for your premiums and get the tax deduction. And if the employers want to get out of employer-sponsored health insurance, which most of them do, they could say, look, I'll just put those dollars I'm giving Blue Cross and I will put it in your HSA, and you can go out and buy your own plan, pick the plan you want. It's permanently yours. You don't have to worry about changing jobs and worrying about, is my doctor going to be in this new plan, or what about my pre-existing condition now? Will that be covered? So in order for that to really work, then we need to do something else, and that is raise the amount you can put into your HSA. Now it's $3,500, raise that up to $9,000. If you have a family, it can go up to $18,000. Why is that important? So that you can pay your premium out of it and still save up for medically qualified expenses. There's something else that we need to do. Not enough people have employer-sponsored health insurance plans, nor the plans on the private market that are HSA qualified. It's such a narrow niche now compared to what it was when the law was passed in 2004. So how about if every plan is HSA qualified? That includes Medicare, VA, TRICARE. No matter if you have a health plan, a Christian sharing ministry plan, a short-term medical plan, it's HSA qualified, and you can use those dollars to pay for that plan, which gives you the tax deduction that employer-sponsored plans enjoy. It's about time that we equalize that. All of these things are important because the other thing we are working on is to get rid of those federal regulations that caused our rates to go so high, return back to the state of Kansas the authority over private health insurance plans. We can get back our 17 carriers that we had before.
Absolutely.
And so if we have this broad market with HSAs that now you can buy your own individual policy, again, plans are going to be so plentiful. Think of auto insurance and lots of different plan designs that are much more affordable. This is what's coming. This is what we're working on. I encourage everybody to go to Health Care for You, all spelled out. You can see the plan there, and the Republican Study Committee, and it's called their framework. Very similar plans, one's grassroots and one's from the inside.
Perfect. So we're going to cut away now, and we will be back with another video. So just stay tuned. There's a lot of information here. Thank you for joining us today.